So Dr. Bilski, doing like a dental implant sounds like some pretty heavy duty construction going on in there. What does that do to the gums? Going to ruin the gums or affect them?
I think no, it's a great question. Anything that a doctor will do for you, you have to know the benefits and some of the risks when you do this. Under stable conditions, you're missing a tooth and we want to replace the tooth. That's what dental implants are designed to help us with. So the actual procedure is we have to make an opening into the gum, provided there's adequate bone, place the dental implant, and it's solid and stable at the initial placement, and then placement of the gum back into position should all be supported. So we're waiting for the implant to be accepted by the bone, so the bone fusing to that dental implant. Yeah. So we want to be careful with our terminology. Well, sometimes we'll hear, well, I had an implant and my implant failed. The implant didn't fail. It was the failure of the bone to integrate or to grow, to fuse, whatever the words are that you want to use. And then the blood supply that is supported by what's called periosteum and the gum tissue, two elements that keep the circulation in that area of the bone and the gum healthy. So can a dental implant injure or hurt the gum? No, provided that you have the proper placement and the supporting structure, the supporting foundation of the jawbone, and that you're relatively healthy. We don't have, we're not fighting with medications that may counter to it. How are your vitamin D levels? Are your minerals, are we all in balance? Was there prior infection? So there's some things. So the best way to say that is get a really solid consult. With a professional that does dental implants, that places implants, that puts teeth on implants, and then understands the physiology of the body. And if it comes to a point where we see a patient that's called, may have medical complexities, diabetes, heart disease, deficiencies, autoimmune stuff, we definitely want to consult with the physicians and make sure that we're doing what we're supposed to be doing and has the physician optimized their general health.
So you're taking a good look at somebody before anything gets done and go, this is probably going to be fine for you, or we may run into, that's prudent thing to do.
Just an example, like say somebody had a heart condition and everything else seems to be okay. So I would consult with their either cardiothoracic surgeon or their cardiologist or their primary care physician and just say, hey, is this patient's health been optimized by the regimen or the suggestions that you are making for the heart health? And then a lot of times if we can't speak with the physician or the physician's assistant, they'll say something like, again, Randy, if you had a heart condition, like, yeah, well, Randy comes in, we see him regularly, but he's still knocking down cheeseburgers and slugging beers. So no, he's not the greatest. You might want to hold off on your dental implant procedures. So then Randy would come back in and say, hey, look, I had a nice conversation with your physician. He or she is very concerned about your health. They seem to believe that you maybe are not
knocking back the hamburgers and beer.
Yeah, you're not shutting down those things. So we're going to postpone. And why don't you get back and see Dr. Smith and Jones? And
I'm curious. Does anybody say, hey, no, I don't care, do it anyway? I mean, you ever put in that position where they...
So, yeah, as a matter of fact, yes. And the way I handle it is we have a little statement that is a core value in our practice. We're equally as proud of what we do not do as what we are able to do. So if it's a bad situation and I feel it's not in the best interests of your health or your oral health, then we would say, no, I'm sorry, maybe this is not the place for you. And once you get yourself maybe better under control with your heart condition and your overall health, let's revisit this and come on back and we'll have a nice chat about it.
I'll tell you, if you're interested in a dentist who sees beyond the smile, even though that Bilski Dental Group, right?
Yeah.
I mean, that's nice.
Check us out online. It's bilskidental.com. You can log in online and schedule an appointment or certainly make a phone call. And there's also a little robot if you want to type something in, and we get that and we'll follow up the next day usually, or maybe the same day.
Thanks for watching.